This is LiveWell Talk and Occupational Therapy. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. While some people may be celebrating Jazz Appreciation Month in the month of April, it is also Occupational Therapy Month. And joining me today to talk about the topic is Jim Pazour, Senior Occupational Therapist at UnityPoint Health, St. Luke's Hospital Inpatient Rehab. Welcome.
Thank you very much. Good to be here.
You know, I've said this on another podcast. I've said it to other people. I think occupational therapy is really cool. I love the cleverness and the problem solving, and I just think you guys do a phenomenal job, and patients are so appreciative. It gets them back to their previous status of life and activities. But I just think it's phenomenal. But tell us what occupational therapy is, because I think sometimes it's misleading, Jim. Occupational therapy, people think this is somehow related to employment or work, when I don't know what else you'd call it, but that's kind of misleading. So could you clarify that?
I agree with that. I think that's always the running joke in OT, right? Like if I had $1 for every time a patient told me I didn't need a job, I have a job, I don't want to get a job, could retire early, because, we always have to come back and kind of address that. I think at its fundamental core, what OT is so much about is really enabling people to get back to the things that they want to do within their everyday lives. And I think that's what makes it such an exciting profession, but also a hard one to kind of nail down to being just one thing. And I think often we want to be able to do that and define things by being a single entity. And really OT is so multifaceted as it relates to working with people, whether it be on the classic things like getting up and getting dressed, to the functional mobility, to functional cognitive skills, to upper body rehabilitation, visual spatial scanning, visual work. It's such a multifaceted profession, and we work on so many different levels with people in so many different ways within their lives. I think it's always been what the challenge for OTs has been, is to really identify that in a way that people can understand what we do. Because we do so many different things within our profession.
Yeah, it is misleading. It kind of, it's kind of like, I kind of always thought of it as more of like an engineering specialties, where like, a chemical engineer can do electrical engineering to a certain degree, but, an electrical engineer doesn't do chemical engineering, so it's kind of like physical therapy does their thing, but then occupational therapy does activity and movement plus more.
Correct. I would agree. I mean, that it's taking a look at somebody's mobility, and we certainly know being mobile in and amongst itself is one thing, but just being mobile doesn't make you functional, and it doesn't give you back your life. And you need to have all those other aspects to go along with that. Whether you're an individual who wants to get back to fishing, well, that's something we work on. Somebody wants to get back to golfing, some of those other life skills that go beyond just getting from point A to point B. To me, so many patients exemplify that. I can get up and I can walk, but now what do I do? And that's right. So much where we come in and saying, now there's a whole other world that we have to explore to get you to do, be it the way you did it before, or coming up with new and ingenious ways to get you back to doing those things.
Now, the education, walk me through that. Some of these paraspecialties, that's probably not the best term, but I think it parallel specialties to physicians have gone to this either master's or PhD programs. It comes to mind, pharmacy, athletic training now is a master's program. Right. Pharmacy is all PharmD now. So where's occupational therapy?
We're basically along that exact same course of action. Years and years ago, it was bachelor's became masters, and now most all of our master's programs are converting to the doctorate program. So really kind of following that same line of thought as it relates to education and training, and then professional development is really headed in the exact same vein. I can't tell you the exact break in terms of schools that are doctorate, but there's more doctorate programs and master's programs now, and we anticipate that continuing.
Yeah, I think that's a trend across all specialties. Give some comments. You mentioned phishing, but give us some common scenarios that people are sent to you for therapy.
Boy, that's a good one. It's really a lot of different diagnoses, but ultimately all relating back to sometimes the same basic piece of somebody's got an inability to complete the tasks that they want to, whether it's getting up and getting dressed, whether it's using their arm. In OT, it can be returned to driving, for example. We do a lot of work with driving. And so as those, people really arrive, as like any healthcare professional, it's about identifying kind of where those breakdowns fall. And then what do we need to do to help that individual? I think that's what's so fun about it for me is every patient's a little bit different and every problem's a little bit different. And so I don't feel like as a profession, it's ever really stale. It's always, evolving and growing and changing. I don't know if that exactly answered your question.
Yeah, I think that's what I like about occupational therapy is its uniqueness. I've had a lot of mutual patients over the years with your team, as a hospitalist, and also wound care. Because those present a challenge, perhaps getting their leg compressions on, et cetera. And so we depend on our occupational therapists to help us. Lymphedema therapy, I believe that falls under occupational therapy. Yep. I mean, so there's a lot of things that you do that patients probably don't understand. But so you work with, take us through how your relationship to physical and perhaps like speech therapy on the inpatient side.
Great question. I think, as you said earlier, there is a little bit of overlap within the professions, but then there's also kind of the core areas that we do. And I've always felt like a little bit of the overlap is good because as what we know in recovery, no matter what your problem is, masked practice is one of the things that really helps get you better. And so having some of that overlap just means that your patient is getting more throughout the day. In terms of relationship with the professions, we really work very well together within this organization. The nice thing is that we don't have these really hardcore defined boundaries. So we do overlap, but we work together in terms of, what are you working on with the patient or what problems have you seen that are going to help me help the patient better with what I'm doing. And so often I think that's one of the values of having so many different professionals is more eyes on the client, more eyes on the patient. You get a better handle with what they're doing and what they're not doing.
Yeah.
And then we can really talk to each other about that to really augment our treatments and what we're going to do to help them.
Yeah, it's yes, because you're there at the elbow with them and you get a real sense of how they're doing. Whereas a physician, you kind of get a biopsy of this narrow window of their day, where I think as a therapist, you get a larger window and probably a more accurate assessment of safety with safety going home from the hospital. How just give a brief summary of how the pandemic affected occupational therapy in your clinic and what changes do you have to make? Because social distancing,
Sure.
Occupational therapy, maybe part of it could be tele, maybe, I don't know. I think there'd be certain things that might, but it's a hands-on specialty.
Yeah, we talked a little bit about telehealth, but realistically, that was very difficult for us because of that exact fact that so much of what we need to do, we need to see what they do. We need to be with them, beside them, hands-on, those sorts of things to kind of get a good idea of where to go and what to do with those patients. I think really what the pandemic did for us, a couple different things is I think the evolution of what OTs can do in the acute care area was really grown in terms of how they're working side by side with PTs and the nurses, really on those acute care floors and really mobilizing those patients and getting them moving forward. For those of us more along the rehab line, I think it was a really an opportunity to really expand your knowledge and really learn about new things and new diagnoses, new treatments, and how did it challenge us as clinicians to change some of the things that we did before in the past? And how do you help a patient when they've got a whole lot more going on than what we initially thought, and really just maybe other areas that we weren't fully addressing, things like some of the cognitive deficits that we saw with post-COVID patients that originally, with things that we had to evolve and learn into.
Yeah, and I think another unique thing about occupational therapy, the occupational therapists, they're pretty upbeat because they see their patients get better. So sometimes in my specialty, people never seem to get better. they still have their heart failure, et cetera, but you really have the opportunity to take some ownership and actually see the patient get better and the gratitude patients have. That's why we show up every day, isn't it?
No, 100%. I always figure at the end of the day, maybe the worst thing I ever offer a patient is hope, and hope is a good thing to have. It's hope that you're going to get better and working towards that goal. And that's really the ultimate piece that we're providing. And then having the opportunity to see people get better. I've often said I've learned more from my patients throughout my career than I've ever taught them. From a pure, satisfaction standpoint, I can't think of a better thing to do every day.
Yeah, that's true wisdom there. I always say that the days where everything goes wrong and I have to stay late is actually the best day because they needed me. If everything goes perfect, it's like, well, they didn't need me today. So it's always nice to be needed. This is really great information. Thank you so much for taking time. Again, this was occupational therapist Jim Pazour with St. Luke's Inpatient Rehab.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.